Good morning, class. Right, let's have a look at you all. Oh dear. Well, I expected a few of you to look a little worse for wear after last night's celebrations, but you're all looking a bit sorry for yourselves, aren't you? Especially you two. My word. Right, anyway, are we all in? Okay, then the first thing for me to do is say Happy New Year and welcome to your first class of 2041. May the best test scores of your past be the worst test scores of your future. Now, my name, for those of you who don't know, or for those of you with hangovers and who can't remember, is Professor Brown. Okay? Now, who can tell me where we got up to last time? Anyone? Come on. No, I'll just do it myself then, shall I? Right, well, this is the title of your lecture today. The effect and influence of scientific research, development and application in the preceding 25 years, which has significantly shaped present-day medicine, society and the individual, specifically relating to the comprehensive and complex discipline of tissue engineering and repair. Or, if you prefer, a brief history of regenerative medicine. Now, I will be using a PowerPoint. Interestingly, PowerPoint in the last 25 years, like the crocodile of the software world, has not evolved at all. See? So, now we will be studying a period of history just 25 years ago, known to us now as the reality TV Dark Ages. It was a time when entertainment hit an all-time low. Scientists were left with little option but to retreat back to their labs, their offices, their kitchen tables, and try and improve the world around us. Which I'm thankful to say they did. Anyway, now, who has done the reading on the era of the 20-teens? Blank faces. Who has any questions on the era of the 20-teens? Yes, you.
Professor Brown, is it true that back in 2016, Donald Trump hypnotized the people of America in order to become president?
I meant a medical history question. Has anyone got a sensible question, please?
Professor Brown, is it true in the past elderly patients received a different doctor for each part of their body?
An excellent question. Yes, strange as it seems, 25 years ago, back in 2016, the concept of treating ageing as a disease was only in its research stages. Around this time, we started to look for the connections in the so-called ageing diseases. Our scientists were looking at the symptoms to try and find the common elements. So that now, you don't need to go and see a cardiologist about your heart or a gastroenterologist about your liver. You simply can go to see one doctor to treat all your ageing. And we've learnt a lot about the difference between lifespan and health span, ultimately leading to a better quality of life for longer. Yes, any other questions?
Is it true that people used to suffer from back pain so severe that they were unable to work or live their lives to the full?
Yes, it is, yes. So hard as it is for us to imagine, back in 2016, people suffering from degenerated discs, were faced with some very bleak options. I'll try try and explain by using these non-specific chocolate-covered, orange-filled cakes. Back in 2016, surgery was very invasive and simply meant removing the damaged disc. Patients then had to suffer long hours of physiotherapy learning to walk without the damaged disc. Now, this didn't even guarantee an end to the pain, and those opting not to have the surgery were faced with a lifetime filled with strong painkillers. And this condition wasn't uncommon. The personal, social and economic impact was quite significant. Many man-hours were lost and many millions of pounds were spent by the NHS. Now, if you don't know what that is, you need to look it up in your history books. Now, thankfully, our scientists discovered that by using stem cells from our own body, we could generate new discs, which meant no need for invasive surgery, a quicker recovery time, and the body could get itself back to normal. Of course, it was many years before we were able to perfect this, but with the help of better imaging techniques, doctors were able to diagnose the symptoms earlier, which means that now the pain and suffering associated with degenerated discs is something completely avoidable. Any other questions?
Professor Brown, is it true that in the past people sometimes had to give up their jobs so that they could care for family members who suffered from conditions such as muscular dystrophy?
Another excellent and completely spontaneous question. Yes, muscular dystrophy was a debilitating illness which worsened over time, often leaving the sufferer with severe disabilities. It was, most unfortunately, a hereditary condition marked by progressive wasting and weakening of the muscles, leaving the sufferer often completely dependent. With muscular dystrophy and other genetic disorders, children and adults were often forced to endure ongoing pain, severe dependency and, in many cases, a reduced lifespan. Family members who were unable to afford private health care were often left little choice but to become full-time carers. Houses had to be renovated at great cost in order that the day-to-day life of these people was made achievable. Now, whilst the human spirit often triumphed and indeed excelled in the face of adversity, our scientists were moved to try and find the world an alternative. They looked to find a cure from the smallest part of the human body, its cells. Let me try and explain by using these non-specific chocolate-covered orange-filled cakes. Now, on discovery of a genetic disorder, the offending gene could be removed and replaced by a healthy one. This allowed the body to heal from the disorder, and in the case of unborn babies, they could grow up without any trace of it at all. There you go. Right, that should be the end of the questions, because we really now need to concentrate on today's topic of tissue injury and repair, and we need to meet today's mystery guest speaker. Bring her in. Okay, so this is Angela, and she is on loan to us from the British Cryogenic Museum, so we better not break her. Right, now Angela, back in 2016, ordered a rather deadly takeaway of sushi containing tetrodotoxin. She was cryogenically frozen just minutes before her imminent death, and today we're going to unfreeze her again in order to gain her unique perspective. I must warn you that she may be a little disoriented. Okay, and by my calculations, she should unfreeze in 3, 2, 1.
What do you mean I got 15 minutes to live? I've not finished watching Game of Thrones yet. What the fuck?
Okay there, Angela. You You are in a safe room. No need to panic. So, Angela, 32, single, and at time of death, living in West Didsbury.
At the time of what?
You are our guest speaker today. Now, could we ask you a few questions about what life was like back in 2016?
Guest speaker? No, wait, this is crazy. What is going on?
Right. Angela, you have been brought from the past in order to assist these students to gain a greater understanding of your time.
But I'm not even dressed.
Yes, you must be feeling rather self-conscious in your dinosaur onesie. I completely understand. It must be quite a shock.
It is a bit.
Well, here, drink this. This is something we have here in the future to help us feel at ease. It'll help you to talk.
What was that?
Tequila. Feeling better?
Actually, yeah, I do feel a bit more relaxed.
Excellent. Right. Now, Angela, could you tell us a little bit about your family, specifically your grandmother? Well, whenever you're ready.
Okay. My nan was called Ethel, and she was a lovely woman with a huge heart, and we used to go out and she used to take us out to the park.
Yes, but how did she die?
What?
And we're sorry for your loss.
Well, if you must know, it was cancer. Bowel cancer.
Cancer. Still a threat today, but with research and discoveries on antioxidants and dietary restrictions, no longer the life-threatening sentence it once was. Now, Angela, can you remember much about the treatment your grandmother received?
Oh, yeah. It's hard to forget. It was brutal.
Can you share that with our students?
My nan was in her early 70s when she started the chemo, and at first it was the nausea and the fatigue that hit her. She didn't really eat much before she got ill, so that was quite a shock at the time. That caused her to lose a lot of weight really, really quickly, and her appearance changed within a matter of weeks. Most of her hair fell out, and she lost her remaining teeth. The thing that really stays with me is how her skin and her nails changed. She'd always had such lovely nails, and now they were all yellow and brittle. She broke out in this angry red rash on her face and her neck and her hands, and she'd always taken so much pride in her appearance, and we could see it was distressing her, but there wasn't much the family could do other than encouraging her to be brave and press on. She died, of course, and we felt relieved that the suffering was over. We hardly recognised her in the end. It's hard to tell which is worse, the cancer or the treatment.
Thank you, Angela. Now, class, this is a classic example of what a lot of cancer victims were subjected to before the development of carbon nanotubes, called liposomes. I'll explain using these non-specific chocolate-covered orange-filled cakes. Unlike chemotherapy, which ends up attacking the body almost indiscriminately, liposomes are structures made of cell membrane which carry the drug directly to the cancerous cells. They achieve this by using a heat-activated trigger which allows the surgeon to control when the drug is released. This technique absolutely revolutionised the treatment of cancer. I'm only sorry it didn't do it in time to help your grandmother.
So am I.
Now, Angela, There was a specific reason why you were chosen from among the thousands of exhibits at the museum.
The what?
Can you tell us a little bit about the injury you sustained back in 2012?
Oh, that. Well, a few years ago, I noticed a lump on the side of my neck, and the doctors decided to investigate it and do a biopsy. It was fine. It turned out to be a viral infection and nothing to worry about. The only problem was that during the procedure, the surgeon accidentally cut through my spinal accessory nerve. That's the one that sends the messages down here to the muscle around that bit there.
The trapezius muscle.
When I woke up, I had a slumped shoulder and I couldn't lift my arm above my head.
And what was the professional opinion at this time?
Well, they told me that the nerve was probably just bruised and I should wait to see if it got any better.
And?
It didn't. And later, after more tests and me constantly hounding them, they discovered that the nerve had actually been severed. Couldn't believe it.
And what effect did this have on you?
Well, to be honest, it changed everything.
Can you give us some examples?
Okay. I can't put a coat or a jumper on without somebody helping me. I can't get out of a car on my own. I went from being independent and physically active to having to move back in with my parents and live a pretty sedentary lifestyle.
This was not untypical of the kind of fate befalling people like Angela. Back in 2016, the polymer-based nerve conduit was only just starting to become recognised as the truly remarkable piece of equipment that it is. I'll explain using the packaging from these non-specific chocolate-covered orange-filled cakes. This conduit is an artificial nerve, which we now widely use as an alternative clinical approach to nerve reconstruction. This tissue engineering construct can be grafted...
Ow!
Oh, sorry. Can be grafted onto the injured nerve, bridging the gap, guiding the regrowth to the other end of the severed nerve. When you add to that the cultured nerve cells, the slow-release growth factors and other molecules within the conduit microenvironment, the regeneration and restoration of the sensory and motor functions is greatly improved.
I'm starting to think I was born too soon.
Now, Angela, we've asked you a lot of personal questions, but I wonder if we could just ask you one more. Oh, very well. You can put down the polymer-based nerve conduit now. So, Angela, could you tell us, please, why you never had children?
That's pretty personal. But I suppose I can talk about it if you think it's going to help.
Thank you. Take your time.
Well, I guess it was all down to a matter of timing. I mean, I tried Match.com and I tried Tinder, but I never really found that special someone. Perhaps I'm too picky. I don't know. I mean, my mum always says
No, I meant the medical reason. For graphine's sake.
Oh, right, sorry.
Well, it's okay, just carry on.
Well, that all started when I was in my 20s. And I was having really bad... thing was, my lady area was heaviness, and they were
What
just...
she's trying to say is that she was experiencing heavy menstrual flow and was being treated for endometriosis.
Yeah, I'll tell them the story, thanks very much. Yes, I was being treated for that. I was having really terrible stomach pains, really bad bloating, it was awful. And my doctor recommended I had surgery for it, and for a while afterwards everything was fine. The one downside was that the surgery had left me quite badly scarred internally with what they call adhesions. Apparently, I had a lot of them, and what that meant was that I'd struggled to conceive, like, really struggle, if I ever found myself in a position to start a family. There was this one guy, but we just wanted different things. He was really into this band called Perpetual Death Spider, and to be honest, I'm much more of an R&B kind of girl.
And I think we're going off topic again, so just to clarify the point of all this, back in 2016, we were only just starting to identify the markers which isolate mesothelial cells. I'll explain.
Using the non-specific chocolate-covered orange-filled cakes.
Yes. Right. These mesothelial cells are the cells which line the abdomen and cover the organs. We wanted to show that these mesothelial cells actually take a part in the scarring process. With this information, doctors and scientists were able to develop a degradable plaster to be used internally during surgery, the very same article that we still use today. This degradable plaster dramatically reduces adhesions, decreasing bowel obstruction, pelvic pain, and, for women like Angela, could mean they were able to start a family.
Don't think I want to do this anymore.
Well, what's the matter?
I don't think I want to sit here in your lecture here now. Much better my life could have been.
Well, there really was no intention
I
to
made the best of what I had, but I could have had so much better. There's so much I missed out on.
I'm so terribly sorry, Angela.
Well, there's no point in you being sorry.
No, you're quite right, actually. Thank you, Angela. Goodbye.
Goodbye.
Yes, goodbye. And may your life be filled with joy and graphene. 3, 2, 1.
What the?
Yes. Now, unfortunately, we haven't yet found the antidote to the poison that Angela ingested. Hopefully, we'll be able to unfreeze her again in 2065. And when we do, the research that has happened over the past 25 years, I hope with that knowledge, we will be able to give her the kind of life that you and I enjoy today. I also hope we'll be able to give her a couple of paracetamol for that burgeoning hangover. Thank you. Could you take our guest speaker away now? If we could have a round of applause for Angela. Right, now it's time to find out who has done the reading homework. Okay, so question. Back in 2016, if you had broken, say, your leg bone, and the break was non-union, that is to say, it could not be reset, what material would be used to treat you? Anyone?
Metal.
Metal, well done, yes. Metal. Now, this rather nasty looking thing, isn't it? This was known as hardware, this metal and screw combination. And when the injured leg had healed, often this hardware had to be removed, causing further procedures. Patients experienced anything from mild irritation up to extreme pain, and there was always the risk of infection, which further complicated matters. So, our scientists, rather than looking to other man-made materials, looked instead to the human body itself to unlock its own deepest secrets. Can anyone guess what I'm driving at? We mentioned them earlier. Anyone?
Stem cells.
Stem cells, that's right, yes. And I'm talking specifically about adult stem cells, and not just any old adult stem cells. No, I'm talking specifically about adult stem cells from your own body. We can now take stem cells from your own body and make your own bone. So we don't need to do anything with this metal and screw malarkey. No, we can grow bone. Your body can heal itself. And there's a much reduced possibility of the body rejecting the treatment. But bone is not the only thing that we can grow from stem cells. Oh no. Can you tell me some other things? Fat. I've only had... I see what you mean. Yes, we can grow fat, yes. And individuals in need of reconstructive surgery, after, say, an accident or tumour removal, can now have their skin recontoured, filling in the gaps and making the body return to how it looked before. So yes, thank you. Any other things that we can grow from stem cells? Anyone?
Cartilage.
Cartilage, yes, well done. So now, back in 2016, people were given two very distinct options. The first was non-surgical, and that involved painkillers, physiotherapy, and devices that would support the injured joints, such as leg braces or walking sticks. There was also life changes that happened in order to not use the affected joint so much. The second option was surgery. Now, surgery, you had a wide variety of options available to you, but many of them also risked further surgery in the future, and some of them were only available privately. Thankfully, our scientists discovered that you could grow your own cartilage from your stem cells, which meant you could repair the damage to your leg and have a full recovery. Oh no, what's that? Oh, come on, who's that? Own up. You're supposed to turn off all devices. Come on, it must be someone's hollow phone or biological eye clock. Oh, sorry, no, sorry, it was me. Sorry, it was my graphene tattoo. It's telling me that my sugar levels are, well, they're a little raised, actually. I don't know why. Anyway, probably time to wrap it up. So, for those of you who enjoy making New Year's resolutions, can I suggest this? Take a moment every now and then to just marvel at the miracle of the human body. When you go home tonight to your digs, your shared houses, your dorm rooms, take a moment to ponder just how remarkable the human species really is. All the clues that lead to unlocking the secrets of life lie tucked away within us, and it is thanks to the work of scientists past, present and future that we live with and benefit from these discoveries on a daily basis. And remember, even the smallest medical procedure once started out as research. Till next time, class dismissed.
So my interest is in reconstruction after trauma. So at the University of Manchester, we're researching ways of improving nerve regeneration. I think that stem cells have massive potential, and in particular the work that's ongoing at the University of Manchester has the potential to deliver better treatments for patients who have had cancer or trauma or disease of wide descriptions. In particular, there's great potential for the use of stem cells in plastic surgery, in reconstructing defects after cancer surgery or after trauma, and regenerating wounds, nerve injuries. I'm very optimistic about improving patient care as a result of some of the developments in regenerative medicine that are ongoing at the University of Manchester.
My work is mainly based on devising a new drug delivery technology to change the way that traditional anti-cancer drugs are given to the patients. So the technology that we are developing at the moment is about coming up with the smart next generation of liposome systems. So liposomes are already in clinical use for the past 30 years. However, the lack of control on the drug release once they are in the cancer area remain an important challenge. The impact of the research that we do have a great effect on the medical world because it will change the way that the traditional drugs are given to the patients by improving their efficacy and as well as reducing the suffering the patient experience from the side effects.
I'm one of the people pushing for the translation of biomedical applications of materials, nanomaterials, including graphene. Well, regenerative medicine is a very young medical intervention discipline, which I think conceptually offers an advantage in the sense that you're trying to ask the tissue to regenerate itself and solve the problem itself rather than you intervening and solving a consequence of the problem. And I think that this conceptually is very, very interesting. The use of nanotechnology in medicine has already an impact in clinical practice. There are many different tools that are based on nanoscale, ranging from diagnostic agents or delivery systems that can deliver therapeutic agents at specific sites in cancer patients, for example, that are proving very, very valuable to clinicians. We are expecting and hoping that this is going to grow exponentially in the next 10-20 years.